Good afternoon, this is Jim, physical therapist with Ortho Montana, and today we're going to address a common and frustrating issue that people kind of deal with after they have their knee replaced. Things like we've talked about in the clinic leading up to this video, and that's going to be swelling. So it's a pervasive problem for several reasons. Of course, the assault to the joint with the trauma to the bone and the soft tissues, but also the tourniquet effect, like we've talked about. So they wrap that tourniquet around the thigh. It's there for several minutes, even a couple hours, and it can disrupt the drainage that comes out of your leg and also shut down your thigh function. So, that being said, a little rubbing of the leg can go a long way in getting the fluid to dissipate. So, we have Christine lied down here. When you're home, you'll probably be on your bed, and I have 5 pillows under Christine's leg supporting this leg. So if we expose her thigh, you'll wear some shorts at home, and just make sure you don't have any direct pressure under the knee or really under the calf. So my hand can freely move under there. We don't want to occlude any blood flow to those areas. So the next thing to look at is the level or the elevation of this knee. So we have her above the level of her heart. And that's a good thing to let gravity just take over and move some of this fluid out. So the steps would be this. We'll talk about basically 5 regions of the leg to rub, starting at the hip, moving up to the foot, but always moving the fluid this way, back toward her heart. So the 5 areas are these. Right here at the hip, then we go to the thigh, then the lower leg, the foot and ankle, and then the entire leg. So in each of those areas we rub for approximately a minute. So the pressure is very gentle. When we start here in the hip, it's a little circular motion right in the crease of the hip. If you think about your leg bending, where you get that crease, that diagonal crease, that's where you'll rub very gently. So you could do this as the patient, as you lie with your leg elevated, or have your loved one or spouse do this. Just a gentle little circular motion. Doesn't matter if you go clockwise or counterclockwise. And that's about a minute. Then you move up to the thigh. So from the knee to the hip, you just very gently pull that fluid. Pull that fluid. You want a lot of surface contact with your hand on the tissue. You don't want to just use your fingertips like this. And it's not a hard grinding pull either. Just a very gentle pull. You want to also keep in mind that you don't want to have any lotion on your hands. You want to create some friction as you pull this fluid. So just a gentle little pull from knee to hip. Then we move up to the lower leg and go from ankle to knee. Just the same fashion. Alright. Kind of getting behind that calf. Stopping at the knee. You'll be careful to stay away from this incision along the central leg, knee. Just keep your fingers away from that. And that's about a minute there. Then you move to the foot and ankle. Even if there isn't much swelling in the foot and ankle, still do this. Get to the toes, move down to the foot, into the ankle, lower leg. So a minute of that. And then you can just stroke the entire limb from toes all the way to the hip. So you do that for a minute. Now after you complete that, then you're going to gently pump this fluid out of the leg. So you can support behind your patient's knee, grab their ankle, and we'll just do this straight leg raise motion. So again, we're going to pump this fluid right out of that hip area. And you maybe do 10 of these. You can do more if you'd like, if they're comfortable. Just go to the range the patient will endure. Then you'll move into a knee bend. Still supporting the knee. Gently bend the knee toward the chest, back and forth. bend and straighten. So pumping the fluid out of the knee region. About 10 of those. And you come back down, support on the pillows, and then Christine can actively pump her ankle. So we get this active muscle pumping, getting the fluid to move out of this limb, and that's the cycle. So you do that roughly 3 times through, the rubbing, the moving, and that should be it for your cycle. Twice a day if you're comfortable doing that. And just remember your body mechanics when you're standing and moving this fluid.